Hi everyone, I'm Dr. Parul. I'm board certified dermatologist, and today we are going to talk about how to take care of oily skin, or in fact how to reduce the oil production on your skin surface. Whenever you have oily skin, you're glossy, you're glowy, your skin is very dull, and in fact you have a very rough skin because of the clogged skin pores. Excess oil is produced from within your skin and all your oil glands, and that makes your face extremely glossy. Sometimes you may not be able to even put your makeup because it looks very shiny and you look almost like a fried person. So then today these 10 tips will be of great help to you. How do we really take care? You cannot miss the basic foundation steps of cleanser, moisturizer and your sunscreen. But how do you take care? Cleanser has to be one which is very gentle. Gentle doesn't mean it doesn't have any active. Your actives like salicylic acid, you can have benzoyl peroxide, you can have your glycolic acid to remove all the dust and the clogged pores so that your pores get cleaned and you have a nice skin. Post that, your cleanser should not be so harsh also that it's pulling out all your essential oils, so that it is gentle yet it has actives. So make sure you pick up your face wash or your cleanser for oily skin. The second is moisturizer. If you thought that oily skin doesn't need a moisturizer, yes it does. Oily skin, you can pick up moisturizers according to your skin type. So you have non-comedogenic, water-based, thin moisturizers which will give you good amount of hydration, but at the same time not make you very look greasy or maybe oily. So pick up the right ones. The third is sunscreen. Again, if you thought your face becomes too black or maybe too oily after your sunscreen, the sunscreen which you've picked up is the wrong one. So how do we pick up? Use a matte finish one, so that if you apply, you don't even look as if you've applied a sunscreen. A broad spectrum, something called as non-comedogenic. When you're purchasing, see this word, you need to pick up something like a non-comedogenic property and use that for your sunscreen. These are the basic 3 things which you cannot miss. The fourth one is something for the night skin routine. Now we actively at night, I've told you that we have to reduce the oil of your skin glands. How do we do that? By drying it up. Basic vitamin A. So vitamin A means retinoid. Retinoid can be prescription retinoid. So your doctor will advise and give you some creams if you have got lot of oil or acne, like adapalene, tretinoin. There are many other available which will help in drying the oil production from your oil glands. At the same time, if you have a matured skin, like somebody having fine lines and wrinkles, anybody above 45 years of age, then retinols can be used, which is again vitamin A, and that works little slowly but yet reduces the oil production, making a good balance on your skin, so that even if at 40 you have oily skin, it will reduce down. So retinol, that's vitamin A, is a must to reduce your oil production. The fifth thing which I want to tell you is AHA, alpha hydroxy acids. You must have seen many a times doctors prescribe glycolic acid creams, lactic acid creams, which is a great exfoliant. These are called as AHAs and they help in reducing the oiliness of your face. So glycolic acid creams very commonly available at the chemist, but exact percentage and which one according to your skin can be prescribed. They help in exfoliating the upper layer of the skin, giving your skin a little more dryness, and then post that you will have a great and a shiny skin. Next point is your diet. Be aware of milk, means dairy products. Sometimes even fried food leads to a lot of oil production. Lot of masalas which sometimes Indian foods have. You can omit that because these all help the skin not to get oily. All of this stuff is high glycemic index foods, like your fried stuff, processed foods, burgers, pizzas, all increase the production of oil. So if you are in control with these foods, you will definitely be much more better. Next point is hormones. Many a times people have PCOD and some kind of hormonal imbalance, because of which their skin tends to produce a lot of oil. So hormonal pills, like if you have PCOD, Diane, or sometimes spironolactone, can also be advised by your doctors to reduce your oil production, and that will help to balance out the skin. The next point is makeup. You always would feel that oily skin people cannot use the makeup. Yes, you have right makeup sets for oily skin. Make sure they're not heavy, they are non-comedogenic and good for oily skin. Pick up those. Do not over bombard. Make sure you're using and removing the makeup at night by double cleansing method and removing it with micellar water so that your clogged pores are not visible and you don't have oily acne breakout. The next point about treatments. So treatments, there are many treatments which are available, like your glycolic acid peels. You also have carbon lasers, which especially work on oily skin glands, reducing the oil production and reducing your oiliness of the face. So these are about 10 points to help reduce your oily skin. We all live in humid country, so that's where oil production is very common. In that case, making a good skin barrier, a healthy skin is extremely important, and that's why your internal hormones, your diet, your lifestyle, whatever you put on the face, that's why holistic skincare is important to take care of your skin.